Yes.
Beautiful.
Check is the
Okay.
one.
All right,
Great.
the recording button has been hit. Should be good.
Great. Thank you very much. Okay, so we'll go ahead and start our March PACES Pediatric Advisory Council for EMS. A couple of agenda items that I'm listing off, and Julia, thank you for sending me these notes because otherwise I'd forget. So housekeeping, I'm going to be calling us to order here. It is a taped session, so please be careful what you say because your comments will be kept in perpetuity. I would also ask people to keep an eye on their mics, mute when you're not speaking, and that's the easiest way to keep up with it. If you're on a phone, my understanding is you can do *6 to toggle the microphone on and off. Shelley, thank you very much. We'll monitor our chat boards so you can either use your mic, and it's my preference, but it's up to you. We have a small enough group that we can all use our mics, I think. But if you'd rather chat, Shelley would kindly tell us what those questions are, and we'll make sure we announce that out when it comes to discussing that. As far as the attendance report, Shelley, would you like to display that? So here's our attendance report. If you miss 2 consecutive meetings, the Bureau is going to be contacting you to make sure that you're still interested in being a formal member of the Advisory Council. We do have an open participation in the committee, but for voting, we do need quorum and we need regular participation as much as humanly possible. We all have busy lives, understood. Currently, well, actually, Julia, is this a time to talk about vacancy issues, or do you want to bring that up a little farther in the agenda?
We can talk about it now. Do we need an official roll call, though, Shelley?
Oh, goodness, I got ahead of myself. My apologies.
I think I got most people down, but let's just do that really quickly.
Yeah, so that was the housekeeping. So yes, please. Sorry about that.
Oh, no worries. Okay. Let's see here. Dawn Darling.
I'm here.
Awesome. Dale Woolridge.
Here.
RJ Dieters.
Good afternoon, everybody. I am here.
Awesome. Thank you. Jordana Carpenter.
I'm here.
Perfect. Thank you. Tony Carazino.
Good afternoon, everybody. I'm here as well.
Mickey Kovac.
Here.
I know Heather Miller is not going to be able to join us. Jackie Evans. I heard her earlier. Tony Huma. Ann Stafford.
Here.
Chris Ramos. Debbie Johnston. And then Dr. Augenstein will not be able to join us. Okay. Thank you, everybody. We're good to go.
Okay. Again, I got ahead of myself. My apologies. Let's get back to the attendance report. I did mention the attendance for the quarterly meetings and to see if you want to maintain your participation. And if you missed more than two meetings, the Bureau will reach out to you. As far as vacancy is concerned, we welcomed Tony from the Northern Arizona EMS Council to our group, and very, very appreciative of having Tony participate with us. We just found out a little bit earlier today that Julie Augustine, who is at Phoenix Children's and directs the EMS program for her hospital, has an unavoidable conflict with this quarterly meeting. She expressed her eager interest in participating in breakouts in the subgroups, but as far as participating in the quarterly meeting, did not see a solution towards that. My question for the group is how to approach that vacancy. I like the fact that we have Phoenix Children's participating in our group, and would advocate that she identify a replacement that she would suggest, obviously pending the approval of this committee. But I want to leave it open to discussion as to how to go about filling that future vacancy. Any comments from the group?
They're probably in the bylaws as the role would be appointed by the medical director of the Bureau.
Okay. Okay. Shelley, is that following applications?
Yeah, people would submit a letter of interest and a CV to Julia, and she could pass that on to Dr. Bradley.
Okay. All right. Very good. Okay. And if that is an open application process, anyone here on the call, if they feel like they have someone who would be a reasonable committee member, we want to make it a wide search. We like to have valuable colleagues working with us. So,
And just to add, her role was titled emergency physician, I believe. So it's pretty general, but.
Okay. All right. The next item on the agenda is to discuss the Safe Sleep Work Group and give an update on that. I don't know if people had an opportunity to go to the Bureau's website, but it is posted in the educational section, and you can download both the slide set and the toolkit. Is my Julie?
Hey, I think you might be looking at the agenda from the last meeting.
Oh, for goodness sake, really? All right, sorry. I'm going to turn off that screen.
It's all good.
This was the root of my problem in the first place then. Okay. So Julie, the stage is yours, the Bureau report.
Okay. Just a couple of quick updates from the Bureau. The Bureau has been undergoing a lot of staff changes recently. So yes, and we can put the link to the Safe Sleep in the chat for you. That includes Ben Fisher's role of services section chief. That job position is currently posted. So if you know anybody who would be interested in that, that's open. More relevance to this group is Allison Welch recently left the Bureau, and so I transitioned into her position. So with that, we do have an opening for the EMS for Children coordinator position, which will be working closely with this group. So that position is currently posted. If anybody knows anybody that could be a good fit for that role, I would encourage you to reach out to them and encourage them to apply. Moving on, the National EMS Data Analysis Resource Center Nadar survey. So that was a survey of EMS agencies that we've been conducting. Thank you all for taking the survey or promoting the survey in whatever way you were able to. Tomorrow is the last day of that, and we've gotten about 74 respondents. So that's pretty good, I think, considering everything that's going on. The National Pediatric Readiness Assessment will take place this upcoming summer, starting in May. So I will be sending materials out to the group and asking that in any way that you have contacts with hospital emergency departments, you would be able to share that. So essentially that's similar. Actually, I'm going to share my screen really quickly. Shelley, if that's okay. So just a little bit of information about the about the Pediatric Readiness Assessment, just so everyone's aware. So essentially, it's a national assessment for hospital emergency departments to ensure that they are pediatric ready and they have resources and guidelines in place to provide effective emergency care for children. What is the 2021 assessment? Determines progress in pediatric readiness. So this assessment was done in 2014. So with the new assessment in 2021, we'll be able to see if there's and what improvements there have been in the last several years, as well as identify existing gaps, promote quality improvement efforts in emergency departments. And then they have done some different collaboratives so that hospitals and state partnership programs can join together to improve outcomes in their states, as well as identify best practices. So how do emergency departments participate? They will be getting postcards in the mail addressed to the emergency department nurse manager. That's the target of the email communication and postcard communication that they'll get to take the assessment online. Nurse managers who complete the assessment will receive a readiness score, the average pediatric readiness score of emergency departments that are similar in volume, etc. And lastly, participation is important because it helps emergency departments to be better prepared to care for children. So that's just a little bit of information about the assessment. Again, it starts in May and will be going through July, I believe. So if you work in an emergency department or know anybody that works in an emergency department or interacting with those people, I would encourage you to just kind of bring it up to see, to encourage others to participate. Okay, we can go back to the agenda now, Shelley, if that works. Okay, any questions about the pediatric readiness assessment? Okay, and then lastly, I just wanted to say, as part of another grant that the Bureau had from the Governor's Office of Youth, Faith, and Family, we were able to create an interactive adverse childhood experiences training for EMS. So that I will post the link in the chat box right now, but it's on the Bureau's EMS education page, along with a link to order resource cards. We developed some cards with different resources that could potentially address adverse childhood experiences. So you can order those and receive those for free as an EMS agency. That's all I have for the Bureau reports.
Okay. Just making sure, I heard earlier Chris was going to be able to join us, just confirming he's not on the phone. If that's still the case, Julie, would you like me to do the Education Committee update?
Yeah, that would be great. Thank you.
Okay. Well, as everybody's aware, we created a tracheostomy care module, and that was assembled and submitted to the Education Committee for review. We walked the committee through that slide set, and there was some valuable feedback. But all in all, the punchline being is that it was approved with modified changes. And again, the approach is, or the strategy is, to have these educational tools posted on the Bureau website for our EMS agencies to be able to use to instruct their pre-hospital providers, and that they would be essentially a CE compatible packet for them. The request that the Education Committee had was one, a simple request was that pediatric be a little bit more predominant in the title of the slide set, so pediatric tracheostomy care. The second was, and I think very reasonable, one individual had brought up the fact that not all pre-hospital providers have the skill set, or does their agency allow them some of the management techniques that we educate about in the module. So they asked that we put a qualifier slide, big and bold, up early in the slide set, that one should use this education, but should comply with their individual agencies' protocols and as defined per their training level of training. I would ask the group someone who might be more familiar with that kind of a legalese disclaimer and guideline to maybe help me assemble that slide. But I think those were the components that they had requested that we change. The last was to make this more of a complete slide set for CE is to have some like a bank of questions afterwards, so that one can do a pre and post assessment, and again, as a component of making it CE compatible. A couple of weeks back, I emailed to the subgroup an example question that I had generated. And what I would ask the group is if Julia, you would maybe send that question out along with the slide set, and then we ask anyone who's willing to be able to write a question. And it would be a multiple choice question with a text explanation of why the correct answer is correct and why the incorrect answers are incorrect. And again, we'll send you guys an example, but anyone who's willing to write a question, I'm thinking we probably need about 6 to 8 questions to be attached to our slide set to make it a complete CE compatible module that we can put on the Bureau website. And Julie, as far as final processing, once we get those items together, does it go back to the chair of education, or does it have to go to the through the quarterly meeting again?
I believe the questions would need to go through education committee, but the slides, after we have updated the slides, we can go ahead and put those on the website.
Okay.
But the questions would need to go back through the education committee, correct?
Okay, great. So we'll be able to post the slide set pretty promptly if we get those 2 small changes done. And for everybody who helped in that that slide deck to review it and or added slides, we do appreciate it. I think this is a good resource that we're offering the EMS agencies through the state. And we keep going at this rate, we're going to, put together a pretty good education bank. So I'm excited about that going forward. So thanks everybody for that. The next on the agenda is to discuss, amend, approve the draft minutes from our November meeting. And if Shelley, you'd be willing to display those. Shelley will slowly scroll through them, and anyone who wants her to go slower, please do. So I would like to request, I would like a motion to discuss, amend, approve the PACES meeting minutes. If I can have someone to initiate the movement and to second it.
I'd be willing to make a motion.
The motion.
Great. I'm sorry, who was that? If we can put a name to that.
Jordana Carpenter.
Great. Thank you, Jordana. And can I have a second?
I second it. This is Dawn Darling.
Okay. All right. So that's for reviewing. So Shelley's going to scroll through it for us. Okay, does anyone have any edits to our minutes for our November meeting? All silent. Then I would ask someone to make a movement to approve our meeting minutes.
This is Dieters. I move that we approve the meeting minutes for the past meeting.
Thank you, RJ. And can I have a second?
This is Jordana. I'll second it.
Jordana, thank you very much. Okay. Great.
Then to do the vote, right?
Oh, goodness, yes, thank you. I'll get better at this. Okay, so let's go ahead and vote. All voting members who vote to approve our November minutes, say aye.
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 Aye. Aye.
Great, thank you. And anyone in opposition say nay? Okay, the ayes have it and the minutes are approved. Thank you all very much. All right. Okay. And the next agenda item, we're going to talk about the tracheostomy. So this is the slide set that I had mentioned. And as you can see, the cover slide doesn't say pediatrics, other than that it came from our advisory council. So we're going to add pediatric tracheostomy management for pre-hospital provider. If no one objects to that, then that will be our modification. And then my suggestion during the education committee was that right below the objective slide, it would be between the objective and some of the opening introductory slides, we would put a single slide that is essentially that qualifier disclaimer, for one, to work under your skill set, and two, to be able to work within your agency's guidelines. And I would ask someone to help me assemble the language for that. And we can do that offline through email. Is there anyone who wants to tackle that first, or someone who have something they can steal from another educational module that we can use?
Dr.
RJ?
Bourne,
Oh.
I was going to say we can do this internally in the Bureau, because I think we just need to make sure we specify scope of practice and within agency and administrative medical director approved. So,
Oh, wonderful. Great.
Yes.
All right. That makes it a whole lot easier. Thank you, Gail.
RJ also said he could help. I'm not sure if you have specific language, RJ, but otherwise we can do it internally. Thanks, Dr. Bradley.
I suspect the language I'm familiar with would be the exact same that you would be. Similar to work within the scope of your practice of your certification or licensure, and within the guidelines approved by your medical director for whichever agency you work for.
Yes, exactly.
Okay, and
Thank
for the benefit of those who weren't necessarily on the subgroup or who haven't seen this to a degree, Julia can email this out to everybody for those of you who would benefit of having your own set of the slide sets. But I can walk us through it real briefly, but I don't want to belabor it and take advantage of your time. But the slides start out with some introductory slides about special healthcare need patients, and some of the background, the importance of working with families and the guardians who know these children the best. And then it jumps straight into tracheostomy management. We discuss management, troubleshooting, suctioning, and even exchange of the tracheostomy tube. And that is a quick synopsis. Does anyone want me to delve into that any further? I think most of you are aware of this product. Okay. All right. And one of the subcommittee, I think a nice addition was to add links. So the person who is going through the slide set, if they have internet access, the link will take you to resources on the web, and we even have some embedded videos. I shouldn't say embedded videos, linked videos. And those are through YouTube about suctioning and stuff like that. Non-proprietary open access videos. Cincinnati Children, so good sources. Okay, Michelle, you can go a little bit faster if you'd like. And these are the video links that I had mentioned. This and the next slide. Actually, there's a couple more. So, management. Okay.
Good work,
So
PACES.
Shelley, I'm sorry, say again.
You guys did a great job.
Yeah, I'm tickled pink. I think we did a great product. So thanks everybody very much for all your work on it.
Yeah, I definitely want to echo that. A big thank you to the entire PACES committee for putting in the effort to put this together. These are the type of trainings that I think are really hard for EMS agencies to find that are really concise and specific to the pre-hospital environment. And this is a great resource. So this will go up on the Bureau's website, and definitely what we also will try the next time we send communication out statewide is really advertise this so people are aware to look for this specific training, because this is really a wonderful resource. So thank you guys again for all your hard work.
Yeah, I agree. Thanks, everybody. Okay, so back to the agenda. So that's kind of the next thing to think about is what's going to be our next project. What's our next project going forward? As a professor at the university, I'm an educator, so it tends, and if you ask me, to follow to another educational component. It doesn't necessarily have to be. So, resources, education. If anyone has any ideas currently, please open up your mic and let us know what your thoughts were.
I might interrupt for just a point of order. I think I didn't hear the vote for the tracheostomy training.
Oh goodness, I'm sorry.
That's okay.
Thank you, Shelley.
We're all learning parliamentarian stuff together.
So that being said, we got this one out fast, to be honest with you. So maybe that's why I'm not necessarily thinking about it, because we do have education approval at this point. I think as we do our projects, it seems to make sense to have our committee approve it in advance of sending it forward. But this is one where we just didn't want to lose that window of opportunity getting it to the education committee. That being said, Shelley is absolutely right. We need to make sure that everybody in this committee is okay with the product and that there doesn't need to be any more edits or additions. So thank you for that. So I would ask for a moment or a motion to, we've reviewed already, but a motion to approve. And then after we do that, we'll actually vote. So can I have a first motion?
This is Jordana, I'll motion.
Thank you, Jordana. And a second?
This is Dieter's. I second that.
Thank you, RJ. So that being said, I would ask a vote from the group. For those who vote to approve, say aye.
Aye. Aye.
Aye.
Aye.
Aye.
Great. Thank you. And anyone opposed, say no. Nay. Okay, the ayes have it, and the tracheostomy training module is going to move forward. And again, to summarize with those two edits, it will be placed on the Bureau's website. The questions that I would encourage, and I hope the committee agrees, there would be a good attachment to the slide set. We would have that go through the next educational committee for approval of those. And for anyone who's willing to, we'll contact everybody by email. If you're willing to write a question for us, we probably need maybe 5 to 7 more questions. So if each of us tackle one, we'll have plenty. Okay. Thank you for that. And I guess now I can move to the next item to discuss potential projects. There's a couple listed here. Narcan for pediatric patients, child abuse issues, and challenges for case managers and parents in accessing pediatric behavioral health systems. Versus we could add more bullets there and consider other projects too.
Yes, sorry, just to clarify, these 3 options were just ideas that people had submitted after the last meeting. If you recall, last time we asked for ideas. So if you have additional ideas, please bring them forward. And none of these are set in stone.
Any additional suggestions from the group? Is there anyone feel that one of those that are listed takes priority?
Dr. Woolridge, this is Tony. I've got a question for you.
Absolutely.
So I had mentioned to Julia in the beginning, before everybody else had joined the meeting, just a possible other suggestion. We had just created an app for Guardian Air where we have our guidelines and protocols that our crew members can access. But I'm not sure if that would be something of interest for EMS providers within the state, or if even statewide we could even agree upon guidelines for pediatric, for EMT and paramedic and advanced level practitioners for something for them as a reference, if there's a need, or if that's like a rabbit hole not to even dive down.
Actually, maybe Gail can help me with this one. I'm familiar with Southeastern Arizona EMS Council, and aside from the individual agencies having their own guidelines, administrative guidelines, the regional councils tend to have a bank of them themselves. And I think the Education Committee has also compiled some. So there's a variety of options, and the councils don't have authority to institute, but they're made available for each agency to adopt. And I think, gosh, if there was a guideline that was missing in any of those, I could see us putting together that, but recreating ones that, when there's probably, umpteen versions already out there, may muddy the waters further. Gail, what's your opinion about that, if you don't mind?
So in Arizona, I think you summarized that well. In Arizona, we do not have a statewide protocols per se. So we do have the TTTGs, which are statewide guidelines, which are optional, but any agency's medical director ultimately decides what that agency's guidelines or protocols look like. As Dr. Woolrich pointed out, the regional councils in many parts of Arizona have adopted kind of guidelines or protocols for their region. And then it's still up to each individual agency's medical director to decide if they're going to utilize those or not. The statewide guidelines are based on the NASEMSO model EMS guidelines, which are going through their review right now for update. And those, when they get updated, we will kind of update again through PMD. And they have significant pediatric input into the national guidelines. So I feel like the last time around when they were done, and then definitely this time around, Dr. Tony Gross, who was previously here in Arizona, is the pediatric expert who's kind of the liaison, helped to oversee all of those. So unfortunately, probably a great idea, but not something that would probably be able to be implemented in Arizona.
Sounds more like I was trying to open Pandora's box. So I appreciate it. Thank you.
But you kept your fingers. Yeah.
And I'll just quickly speak, not to push the group one direction or another, but I know we have had some agencies reach out specifically with questions regarding naloxone and pediatric patients, and is it safe to give? What dose can they give? And then kind of looking at law enforcement as well with naloxone administration to pediatric patients. And so that was why we had thought about that as a topic, both with when you have the older kids and teenagers with kind of experimentation, but then younger children who may have an accidental ingestion of a family member's both prescription or illicit drug. And so that was why we had suggested that as a possible topic as well.
Mm-hmm.
This is RJ. I agree with Gail for immediacy and cultural presence of overdosing, where Narcan may be a good thing to implement. It would be something that'd be easy to work with. I think it would be something that would be valuable to work with, immediately applicable, and relevant. We're dealing with it, as stated, in all population ages now, intentional or accidental. I would agree with the Narcan for the next project.
What would the product look like? I don't know if I could see it being too lengthy of a slide set, but would you see maybe an algorithmic, an algorithmic kind of layout to a flyer with additional verbiage on rationale, and then maybe a reference page? What would the product look like?
For me personally, sir, I'm I'm kind of in that objective checklist kind of thing. Algorithmic, most certainly. Presentation of patient vital signs, level of consciousness, presentation of any other contributing factors. If this, then is there the presence or reason to believe that a narcotic overdose may be present? And then if yes, here is your dose based on ideal body weight or age group or something on that order. We tend to do ideal body weights for all of our pediatric medicines at PHI Aravac. And then administration options intranasally. So it would be algorithmic and reasonably checkbox. Take the cognitive load off. If this is present, and here's your next step. If this is not present, then avoid this and go to that. That's how I would, almost a buddy badge card kind of thing that we would work with. And then an explanation page somewhere. How does it work? What are some of the other things that people may need value-added answers and questions for? But the algorithmic reference would be pretty straightforward. That's how I personally would envision it. Others may have a different site to it.
Yeah.
I think that Dr. Augustin probably could have spoke better to this, but from what I've seen, you would treat a pediatric patient besides dosing no differently. The algorithm for when to treat with Narcan would be the same as an adult.
Yeah.
It's actually like really frustrating when a kid comes in that didn't get Narcan, but an adult would have in that situation. And that's the first thing we do in the emergency room. And then that fixes the problem. So the algorithm, I don't think needs to change. I think it's more of a dosing education.
Well, and to be honest, and thank you for that, Don, because I'll even extend upon that. It's not even a dosing thing, really. It's a mindset issue, and we used to do this for narcotics and pain relief in kids. For some, people who deal with kids, we don't hesitate, but people don't usually are hesitant to give, morphine to an infant, for example. So I think it's more in that realm. Particularly when you start looking at the dosing in Narcan. The dosing in Narcan is 100 micrograms per kilogram per dose. So at a 20 kilos, which is a roughly 4-year-old, you're starting to hit adult doses. So the therapeutic, the toxicity range for Narcan is null, unless you have a newborn. That's the exception, for abstinence scores related issues. But once you're past 20 kilos, you can really start approaching adult doses. So maybe it is more of an educational component than it is anything else. But I like RJ's statement, and nice and bold. If they're over this age group or this weight, you don't have to be so hesitant on the doses. One, and children deserve reversal as well as anyone does.
And I think that was kind of one of the pieces that has been brought up with some of the questions that we've received at the Bureau, was really the recognition in different age groups with pediatrics, recognizing that a 18-month or 2-year-old that's potentially accidentally ingested something may have a very different presentation from a 15-year-old that's, experimenting and had an accidental overdose, or an intentional one at another age as well. And then getting into some of the pieces regarding where we have parts of Arizona where it may be an EMT, and so they only have an intranasal, the 4 milligram dose. The question was, can they give that to a young child if it's suspected opioid overdose? So I think there was questions about the safety and efficacy at potentially higher doses. So I think those are some of the questions that potentially this group could answer to help make sure we're treating those overdoses.
Okay. So maybe a short slide set with an algorithmic insert might be the way to go. Is that what people are thinking?
Yeah, and I agree with everybody. The human performance side of it is actually deciding to do it for a kid. We see it with other medicines and other interventions as well. We'll give it easily to an adult. It's the human performance side to get it to a kid. So I agree.
Yeah. Okay.
I would say we have probably a daily patient in the ER that has ingested gummies, And when toddlers eat gummies with THC in them, they eat the whole bag. So these are like, extreme doses for a very small person. And those kids often present like someone you would give Narcan to, respiratory depression, altered level of consciousness. And so I think with the huge uptick of that, this is a really good time to put out this information. And I don't know that EMS is the place to like change this issue with the gummies and unsecured containers, but I think it's worth noting.
Okay.
Do we need to make a motion to establish a work group for this?
Shelley?
Or Shelley?
We could put it on the next agenda.
Okay.
Do you want to prioritize what you have in front of you?
Yeah. Well, but do we?
As you have consensus.
Yeah. Can we actually just start running with it? I mean, do we want? So Julie, you're talking about the Narcan one, right?
Yeah.
Do we have to formally vote to create the subcommittee? Shelley, let us know what's the rules. But if we don't, my suggestion is that Julie gets an email out and we start getting a sign-up list, and we can start producing it. What I wouldn't mind going forward, and I think I alluded to it earlier, is that when we create a product, it's so hard because these are quarterly meetings, right? But if we can get full committee input on the final product and then education and then back to us, it makes things in more of I think more orderly. But we're new to this, and we just did our second project. So however we process going forward, and we're forming, we're forming good products, then let's keep moving with it.
For the public meeting needs, it would need to be on the next agenda as something that you're voting on to make that work group.
Okay.
Well, how about this? Julie, if you wouldn't mind, and Shelley, tell us if this is something prohibitive also, but maybe Julia can send out an email to the group, and then we'll start gathering resources, and we'll set the stage. We'll set up our subgroup, and we'll be ready to hit the ground running by the time our subgroup is set up after our next meeting. Does that work?
Yeah, you can absolutely start staging some of your stuff you want to put on training.
Yeah, let's do that.
We'll start collating resources for this. Again, I'm a big fan of not recreating the wheel. There's someone out there who's already put a lot of mind to this issue. So if we can share ideas and look at products that are already out there, we'll compile those. And then when we create our subgroup, we'll be hitting the ground running.
That sounds like it'll work. Great.
Wonderful. Okay, so that's an agenda item for the next meeting, is set up a Narcan subgroup. And did anyone else have any other suggestions as far as other projects going forward? I like the fact of concentrating on one and getting it through, but as we get more efficient with these, there's no reason why we couldn't have multiple projects set up to going forward. Should we, since we're waiting 3 months to set up subgroups, should we also vote to set up subgroups on another topic, like item 2I, which is child abuse, or 3I, which is behavioral health?
This is Sandy. I'm not on the committee, but I would highly recommend we work on behavioral health. We have seen such a huge increase in behavioral health issues during COVID. And I think that would be a topic that would be very important, because if you think about it, emergency medicine is not exactly behavioral health. Just a thought.
No, I agree, Sandy. I chaired the child fatality review for Pima, Cochise, and Santa Cruz, and adolescent suicide is, anecdotally at least, doubled. Our behavioral health patients coming through the emergency department volume is way up. The governor's office just did, I think Ducey just did an executive order in regards to adolescent suicide. So this is a big issue. It is a big issue. So I think if we're going to wait 3 months to set up a subcommittee, maybe we should have this subcommittee on our agenda to set up for next meeting. Would that work, Sandy?
Absolutely.
All right, so then it'll be a formal item that we'll be able to make a vote on if we're going to create a subcommittee on that. Okay. All right, so that's 2 movements going forward for the next agenda item. Anything else for the next agenda? For next agenda for next meeting, excuse me. Okay. If I'm correct here, Julia, I'm going to start doing the call to the public.
Yes.
Okay. All right, so call to the public. For anybody who wants to bring up a topic, issue, an announcement, do you have a training that's coming up? Can we help you disseminate information on something? Any from the group? Okay. Okay. Go ahead.
Dale,
Thank
this
you,
is Ann Stafford. Hi, how are you? Our pediatric emergency care program has gone virtual. So there were a lot of hospitals that did not participate in their recertification last year due to COVID. And so this year we are extremely heavy on site visits for certifications and recertifications because we're picking up all the ones from last year that weren't able to do it before the end of the year and all the ones that were scheduled for 2021. And so we're always looking for people to participate in those site review teams. So if anyone was willing to participate in one and see what it's like, it's all done virtually now. So it is just reviewing documents ahead of time and then participating for about 4 hours on the day of the site visit. So if anyone on is interested in participating and learning more about getting involved, that would be fantastic.
Thank you, Ann. Yeah, I would endorse it. I'm on the the PEC committee, Pediatric Prepared Emergency Care, for full disclosure. I've done multiple site visits. Aside from conflict of interest in reviewing your own site, it is a very cordial and interesting event. You shadow to see how it's done before you're a formal review member. But what I found most valuable is you see how other facilities are doing things and you walk away with great ideas for your own facility. So not only are you helping your colleagues and partners out, but you're learning a lot too. So I would highly endorse it. I think it's a great program. It's a great group. So please email Ann if you want to learn more and participate, and you can shadow on one, and I think you'll be equally impressed. So thank you, Ann.
Thank you.
Okay. Other announcements from the group? Okay. Julie, you want to do upcoming events?
Sure. So there are several upcoming events. It looks like some virtual, some in person. There's a traffic incident management training with CEs awarded. Looks like there are several dates upcoming if you're interested in that. April 20th to the 22nd is the 2021 National Rural EMS and Care Conference. June 15th to 16th, the Center for Rural Health has their annual Rural Health Conference, and that looks like it will be in Flagstaff. Then in July, the statewide Child Abuse Prevention Conference, virtual, and then the Western Pediatric Trauma Conference in Huntington Beach. And then October 7th through 8th is the Southwest Trauma and Acute Care Symposium. And then I think one last one that was missing is the Ames Odyssey Conference. I don't remember the date for that.
That's on June the 9th. Julie.
Okay,
June
perfect.
9th, yes, and it is also virtual. It's a single-day conference this time. And the registration is open, and it's on the AIMS.org website.
Perfect. Thank you.
Thank you.
Great. Okay, with no other comments or events to discuss with the group, I will say our next meeting is July 15th, and it's going to be at the same time. And you'll have Shelley sending a Zoom link as that approaches. Keep your eye out for emails from Julia about our projects going forward. We're going to gather resources for Narcan. And reach out to Ann if you want to be involved with the Pediatric Prepared Emergency Program. And with that, we'll adjourn. And I appreciate everybody's time.
Thank you, everybody. Have a great afternoon.
Thank you.
Thank you.
Thank you.
Thanks, everybody.
Thank you.